Okay, so today was a long day at the Brigham and Women's Hospital in Boston and across the street at the Dana-Farber Cancer Institute, two places for which I am immensely grateful. But as I did several different appointments today and was relatively stressed by most of all of it, I had an idea, and I'll give it a little bit of context. Um, as a young cancer survivor, having had triple positive breast cancer at age 32, I have learned now 10 years later that I am very blessed, one, to still be here, but two, to be monitored very closely. And what that means is that, what might be something that other people would wait on, a small spot in the chest that a test might pick up would be, a lesion that most people have. We all have lesions in our bodies, and probably would either not be found until much later, or if it were found, wouldn't be followed up very as closely, let's say, to make sure that it isn't growing and isn't cancerous. But as a cancer patient, things are very followed up on, and I am very grateful for that. And I want to first state that. So grateful. The flip side, so this is not a but, it's an and. The flip side is that there's a lot of waiting for results. And as someone who's had those results come back with really bad news in some respects, I should say very good news in others, because when you hear you have cancer, you quickly kind of adjust that bar of what's normal, and you very soon find yourself saying, thank God it's this type of cancer versus this, or thank God they have something for me, because there are so many people that they don't have something for. So with all of that, I do realize how lucky I am. And I don't mean this to come across as a complaint, but it is an area that I think doctors and staff and nurses and hospitals need some feedback on. So here's my feedback. Receiving results and waiting for those results is an extremely stressful situation. You don't know if those results are going to tell you that your cancer has metastasized, which would be really bad news. It would, for someone like me, mean that you don't know that you'll get to see your kids go to college, or probably never get married, that you wouldn't become a grandparent. And on the flip side, it would mean that nothing changes. If it comes back fine, we all just move on. See, there you go. It was nothing. And those are two really, really, really different situations. And I haven't figured out how to navigate the time where you are waiting for the road to go one way or go the other. Or maybe, as I've seen many times, it goes somewhere in between where they say, we're not really clear. We think it may be, probably not, but let's check again in 3 months. I live in that space a lot. And so it's hard to know how to navigate that, because to mentally prepare, if that's even possible, is to spare yourself perhaps a shock that you've experienced before and that is immensely painful and scary. But to prepare, you have to let your mind go to places that you don't want to go. So the other side, I don't know, live in denial somehow. I'm not good at that, but maybe I could practice and say, no, it's going to be fine. Just going to wait. Just going to wait. If anything comes up, I'll figure it out then. And that sounds lovely. And sometimes I'm able to do it for some stretches of time. But then I get scared that I've set myself up for a massive shock, like mainly the first one I had to learn at 32, that I have a serious invasive tumor in my breast. So you get the test done, you somehow get through that, which I did today. You then wait. And I guess my question tonight is, could that waiting be any easier? Is there a way for the healthcare system to find a way to get to know patients or ask them or come up with some sort of questionnaire where they can ask me, when is the best time for you to receive this news? Is it in the morning? Is it in the afternoon? Is it in the night? It's really hard if you have a job where you're around a lot of people. Particularly, I was teaching last year and the many years before, waiting for that kind of news in a classroom with a lot of people or in a open office, which a lot of us work in now, right? That's not easy. If it's bad news, you probably want to be around certain people and not around others. If it's good news, maybe that's true too. So it's hard not knowing when they're going to call. Then you start to kind of see a pattern. Maybe, okay, they get to their results by the end of the night. Sometimes they call around 6:30. And so you kind of expect that. And you even go to crazy places like, well, if this person calls in, it must be bad. And if this person calls, it must be good. And the mind games and the stress is immense. It impacts people around us. It impacts us. It impacts eating. It impacts work. And I'm not saying that this is the biggest problem in healthcare. My goodness, it is not. But is it something we could work on? Is it something that we could do just to lessen that fear and that angst that so many people experience when they wait for results, like I'm waiting tonight? I would love to be involved in an effort that does that. And I'm just going to keep brainstorming how could I do that? Is it that doctors don't know? Is it that it's just impossible with their schedules? I don't think it's impossible, though. I think if there was an effort and perhaps if they knew how painful it can be for some people, maybe there would be an effort. So who knows? Maybe there'll be a place for me to help in that education. That was it. Those are just my thoughts as I wait for my scan results to come back.